Department. He's a frontline emergency responder. He's been on the scene treating victims of drug overdoses. The Farmington Hills Fire Department responded to over 6,000 emergency medical 911 calls last year. So, hey, Lynn. My assistant. Just hang on to him for now. All right, next to Mr. Edson, we have Cheryl Phillips, who I think you guys all recognize from the previous presentation, but she's an educator at St. Joseph Mercy Health System. She oversees their health exploration station, and obviously she's an expert in identifying signs, symptoms, and current trends of drug use. Then we have Jim Nitel. Thank you. Yes. And Jim's a member of the Farmington Hills Police Department who serves on the Federal Drug Enforcement Agency, DEA Task Force, and the South Oakland Narcotics Interdiction Consortium called SONIC. And he's one of only 3 non-DEA employees to lead a task force, is my understanding, in the entire country. So glad to have him. And next we have Jody Spitalski, and Jody is a former Oakland County District Circuit Court judge. She ran a drug and sobriety court. She formed a veterans treatment court and currently speaks around the country and works with hospitals on risk evaluation and mitigation strategies related to controlled substance prescribing and malpractice. She's an expert in working with defendants and who are dealing with alcohol and drug addiction issues. And Craig Summers. Craig is the Deputy Director of Michigan HIDTA, HIDTA, High Intensity Drug Trafficking Area. It's a drug prohibition enforcement program working to disrupt and dismantle drug trafficking organizations in Michigan. The mission of the program is to enhance and coordinate America's drug control efforts among local, state, and federal law enforcement agencies in order to eliminate or reduce drug trafficking. There are nationally 28 HIDTA programs, and we have one here in Michigan. And here on the end, closest to me, we have Jackie McParland. Dr. McParland is an emergency room physician at Beaumont Hospital, Farmington Hills. She receives and treats numerous drug overdose patients. Beaumont Farmington Hills is a level 2 trauma center, and in case you didn't know, and I didn't know this, 85% of all hospital admits come through the emergency room. So if you like what you hear tonight, I know that you can hear more from Dr. McParland. She's the featured doctor at Walk with a Doc in Heritage Park on May 18th. So with that, we're going to get to our questions. And thought we'd start out the panel. At the end of the panel, you'll have a chance to ask your questions if you have any. Wanted to start with asking, we're seeing a significant increase in heroin use across the United States and here in Farmington Hills, and I wanted to ask Sergeant Nitel and Deputy Director Summers to talk about that a little bit. Greg, want to start us off?
Sure. The drug trafficking organizations are for-profit continuing criminal enterprises. All they care about is making money. They will push anything, anywhere where they're going to make a profit. Heroin, opioids, fentanyl, are highly addictive. They can make them, produce them very, very inexpensively, and they will sell them to anybody, and they will do it with no care or concern for the lives of your children, your family, your friends.
With heroin.
Your mouth was
I thought so too. Say with heroin, one of the things we found over the years is years ago, a lot of the heroin that came to this country came from the Far East. Many of the Mexican cartels are now growing the heroin, the poppy in Mexico, so it's coming directly out from Mexico. The potency of the heroin is at all-time highs. The price has gone down significantly than it was years ago. And unfortunately for all of us and our children, it's easier to get. It used to always be heroin used to be always that drug that was somebody else's problem, but anymore it's everybody's problem, and we're seeing it more and more in the suburbs. That's why we're here today, and we're taking a very proactive approach to enforcing the heroin laws.
That one. one doesn't work. Oh, is it working? Can I chime in? Do you mind if I chime in?
I would love this.
Hi. You can hear me now. I think everything, I speak to about, 50 or 60,000 parents and kids every single year. And so I want to make it really clear as to why the heroin problem is increasing in our country. There's absolutely all this great trafficking and things that are happening. But in all honesty, we don't have a heroin epidemic in this country. We don't. Because the data shows that 80% of people that move to heroin start with a prescription drug. There were 259 million prescriptions for opioids written in 2012, 240 million in 2014, and approximately 207 written in 2015. So we're increasing the number of pills that are going out that are controlled by the Drug Enforcement Agency. But the bottom line is when your kids get a script, and in talking to all these kids all over the country, there's two things that we hear. One are sports injuries, and one are wisdom teeth. High school sports injuries, they want to get back out on the field. Late teens, early 20s, they're having their wisdom teeth removed. That's oftentimes the first time that they're introduced to an opioid that creates this euphoric effect that Cheryl has talked to you all about. So exponentially, physical dependency increases anything over 3 days. The Journal of Pain actually talks about how physical dependency, not addiction, not abuse, where your body craves it and wants it, happens in about 12 doses. So if the average prescription is 60 pills, the average individual takes 5 to 8. I don't do math, but that leaves 52 pills in your medicine cabinet for your kid to take. And very quickly, their body needs it. Now, we have all this legislation that's happening as well in our country that's really starting to control the number of pills. Their body needs it. They're going to be horrifically sick. So if they don't get that pill or something similar to that pill, like heroin, which they will, they just keep advancing. So I want to be really, really clear about this heroin problem. I'm sorry to sort of usurp the microphone, but I don't want to mislead you all into going home and looking for heroin. I want you to go home and look for pills. I want you to go home and lock up your pills.
That's okay. So I want to maybe follow up on that a little bit. We talked earlier today about the economics of drugs and heroin, and I learned that Michigan's an export state, and I'd like to ask Craig to talk about that for just a minute. What are the drugs that are coming into Michigan and going out of Michigan, and where are these areas that we're having issues right now?
Well, unfortunately, Michigan has become an export state for marijuana. We grow it better indoors than the Mexican cartels do. It's more potent. As the presenters earlier said, 28% THC content for smoked marijuana. Up in Colorado, who's had legalization for the last 2 years, 34 to 36% smoked. For the dabs, the wax, the butters, 80 to 90% THC content. Prescription pills. We divert more pills out of Michigan than many other states. They go to Ohio, West Virginia, Kentucky, because they sell for about double. Some of the reasons are out of your prescription medicine cabinets. A lot of it's bad doctors that are writing bad pills that are part of drug trafficking organizations making money. So there's a lot of reasons. So our pills are going out of state. Heroin, fentanyl, cocaine, methamphetamine, crystal ice, all come in usually from the southwest border, Mexico. None of those things are actually made here in Michigan. Heroin, ours usually here in Michigan is from South America, comes up through Mexico. So those are the areas, and those are the places that things are coming from, and unfortunately we're becoming our own little export state.
Okay, let's go to the medical side for just a moment. I want to ask Dr. McParland, what are some of the symptoms of an opioid overdose?
So one of the first things that you're going to see is a respiratory depression. You're going to see someone's breathing slow down, and usually very quickly, if they overdose, they will stop breathing. And it's very important that you learn CPR, that you are able to administer rescue breaths and call 911, because now our police department and our first first responders all carry a medication called Narcan or naloxone. That is a reversal agent for the opioid. And I would encourage you, if you have someone in your family that is a user, this isn't a time to split hairs, but ask your provider about writing a prescription for naloxone. There's kits available for you to keep in your own home that you can, I see one being held up in the back. There are kits available that you can keep in your own home if you end up finding out that one of your family members is a user, to prevent a death. You can then deal with the opioid addiction, but if they're dead, you've lost that opportunity.
So we talked earlier about finding heroin users with the needle still in their arm, deceased. Jim Edson, you're out on the front lines and answering the 911 calls. And first of all, tell us, how many times have you used Narcan in the past year?
Well, in 2016, we had over 60 patients that our paramedics administered Narcan to, and of those 60 patients, there were approximately 80 doses of the medication that were administered. So there's already been some comments regarding the increased potency of the medication, and we're finding now that where previously, even just a few years ago, it may have only taken one dose of this reversal agent that Dr. McParland mentioned for us to revive that victim. In some instances now it's taking 2 or 3 doses. And of those over 60 patients that we encountered, approximately 25 of them were either in respiratory arrest where there was no breathing but their heart was still beating, or they were in cardiac arrest where there was no breathing and their heart wasn't beating, and we were able to revive 25 out of those 60-odd patients.
I'm just going to follow up with another question for you related to that, because when we get, how would somebody know if it was a drug overdose or somebody just having a heart attack, and should they administer Narcan if they have it, regardless?
Well, that's a great question. The first thing I want to say is, as has already been mentioned, that here in Farmington Hills, I'm originally from Miami, Florida. I grew up in a drug culture, Miami, Florida in the 70s and 80s, and moved here to Farmington Hills in 1994 and raised children here and still reside in the community. So this is a phenomenal community, but we're not immune from the problems that other communities have. And with those problems, those challenges that we and all our neighboring communities are encountering, we're still very fortunate in Farmington Hills because we have an extraordinary system here. We have dispatchers within the police department that are capable of rendering very simple instructions over the phone to assist in a caller determining what type of emergency is and taking appropriate action. Our police officers here in Farmington Hills are very aggressive in responding to medical emergencies, and they're all trained in CPR and first aid, and they carry specialized equipment such as Narcan and defibrillators, where they're on patrol, so oftentimes they may get there prior to fire department personnel and initiate care and contribute to the saving of lives. And we'd like to think that our personnel within the fire department do a great job as well. One of the things that we've done in the last year or so is we've modeled ourselves after Seattle in encouraging our dispatchers to be very aggressive with their instructions over the phone. So if they think that there's the slightest potential that that person may not be breathing, or even worse, their heart may have stopped, those dispatchers are going to coach that caller, even if that caller has never had training before, into doing CPR. And oftentimes, once police officers and paramedics walk in the door, it may be determined that that CPR was actually unnecessary, but we're okay with that. The emergency physicians are okay with that, because we want those family members, those friends, to be as aggressive as they can in trying to help their friend or their loved one until emergency responders arrive.
Okay, let me come over to Jim Nitel this time. And Jim, can we talk about the relationship between drugs and drug use and crime and violent crime?
In my career at Farmington Hills, I've had an opportunity to work in the Detective Bureau to throughout the years, interviewed different drug users, drug abusers, and one thing I found is investigating cases, armed robberies, home invasions, violent type cases, that a majority of the time, a very strong majority of the time, the defendants in these cases were drug users. And they were out there robbing and stealing, and many times targeting the people that they love the most, their mothers, their fathers, their family members, to get money to buy drugs. And the violence, you know, it's at that level, and then there's violence at the other end. When my group investigates drug trafficking organizations, we have, there's incidents where there's rival drug traffickers that end up killing each other. There's things like that. I've had it many times when we're executing search warrants, and the defendants are actually, they're happy to see it's the police because, you know, they say, well, geez, if you were the rival drug dealer, I'd be dead right now. So the violence is at all different levels, it's really, any part of narcotics, when you have narcotics, there's always violence that goes along with it.
Craig, did you want to add anything to that?
Just really quickly, when we were talking about Narcan and reversing the deaths, at HIDA, we collect data now. We've been for the last year. I think one of the things that's going on people don't realize is we don't know how great the scope of the problem is. Nobody really knows. And when you're in a bedroom community like Farmington Hills, you're farther insulated from it. Last year alone in Michigan, we know that Narcan was used 11,389 times. And that's not even near how many times. 1,981 deaths from drug overdoses. You know, they're saying about 20% heroin, 40% of those other opioids, including fentanyl. The fentanyl we're talking about now is not the prescription fentanyl patches or drug that many cancer patients and things get. This is a made fentanyl by the drug cartels, and it's 50 to 100 times more potent than morphine. And the carfentanil we're seeing mixed in the drugs is 1,000 times more potent. And the drug trafficking organizations, there's no quality control. There's nobody there with a pipette and a measure saying 3 grams, 4 grams, 4 salt grains to 8 salt grains of carfentanil is an overdose for a human. And they're making pills up to look like Vicodin and Oxy out of fentanyl, and that's where people are dying. And sometimes, as Jim said, it might take 4 or 6 doses of Narcan to reverse the strength of some of these pills. And I'm sure the doctor could tell you sometimes with carfentanil, the person's dead before anybody could do anything.
Yeah, with the carfentanil, it's deadly on the scene. You're not going to be able to reverse that. But for many of these drugs, we literally put them on a Narcan drip to reverse what's going on. And the problem is huge. And one small dose that we used to be able to give is not waking these people up right now.
So, Jackie, while you have the mic, I'm sorry, do you want to say something, Jody?
May I just chime in?
Sure.
Again, I want to bring it back home to us here in Oakland County a little bit, in the sense that I don't want you to become complacent because your kids are using. How many of you, and this is more rhetorical, but how many of you can pick out a drug addict by the color of their skin? I'll bet what you would say is not accurate, but really you all can, because 87% of the people that use opioids and drugs in our community are white. They are white, upper middle class, and they're using pills. And why are they white, upper middle class kids, 18 to 25, using pills? Because their families are affluent, and they have insurance. And insurance companies and doctors, even good doctors, well-intended doctors, write a lot of pills because they lack the education to know how to write and what to write. And they don't know all the risks and the benefits. Trust me. So you have to get informed on this and understand that it really is your kid. And it doesn't mean that there's something wrong with your kid, but let's go back to that wisdom tooth removal, that 3rd molar extraction, or that sports injury. They got a prescription from a doctor, so they think it's safe, just like Cheryl said. And so they're going to take it, and within 12 doses, which is about 2.5 to 3 days, they could be physically dependent and need it. So you go back to your doctor, and they give you more. So we have to be very cautious and not become complacent. Heroin is terrible, and it's prolific in our communities. But I really want to bring you back home to the pills that are in your medicine cabinet. 70% of our kids get their meds that they use illicitly from a family member or a family member's medicine chest.
Your Honor, just this past Saturday at the Farmington Hills Police Department, and it was nationwide, the Drug Enforcement Administration held Operation Take Back. And during that operation at Farmington Hills, 2 of the task force officers from Farmington Hills were at the front desk, and we took back pills from people's, as Your Honor said, from their medicine cabinets. And on Saturday, in 4 hours, we took in 156 pounds of prescription drugs. So that's 156 pounds of prescription drugs that were in somebody's cabinet or underneath the drawer, and a lot of times, where our kids have access to it. When our kids are smaller, we always try to keep things away from them. And I think, and I'll make this mistake myself, but when they get older, we forget that, they're still as curious, and they're still looking into these areas, and we kind of forget about those things. And when it comes to prescription drugs, not only the doctor's side, but our side too. I mean, we have to be very conscious of what we bring into our house and what we contain in our house.
And there are lockboxes all over Oakland County.
Yes, and we have, at Farmington Hills, we have Operation Medicine Cabinet as well, right in the front lobby where people can bring in the prescription drugs any day of the week, 24/7. So we have that as well. We did participate with DEA this weekend, but that operation is always in effect.
So let me go to our good doctor here and maybe tell us a little bit about what happens when you're at the ER and in comes an overdose patient.
So when someone comes in overdosed, generally they're being brought in by our first responders. Many times they've gotten Narcan in the field. Sometimes we're administering more Narcan. We try to do a little investigation. Are they taking pills? Or are they using heroin? Because it makes a difference on our approach. There can be many complications as we wake them up. They can begin vomiting, especially if they're addicted, and we reverse the effects of the drug. They can be very slow to respond, depending on what they're taking. We may need to put them on a drip of the Narcan. And frequently we see families come in who are either horrified or it's happened again. And there's in-betweens that they often tell me that I really thought this time might be it. And that goes to tell you that you just don't know when's going to be the time that they took a little bit too much. And we try to be supportive. I encourage families to don't do the shame and blame game as you're waking somebody up. There's going to be time for that, but use that as an opportunity to have a discussion with your family members. And if I could make one more comment on the pills, we have a number of people who come in who tell me that there's no possibility of having pain relief with Motrin or Tylenol for their sprained ankle, that they have to have something stronger, or they're demanding that I give them a narcotic for their child. Children emulate what we do much more than what we say. And how we're going to handle the drug problem is going to start in your own home, just as it is with alcohol. If you have a minor injury, can you take Motrin or Tylenol and avoid the narcotics? Or are you going to be the person who's demanding that you get a narcotic prescription? Because your children are going to watch that. They're going to see you come home with a laceration on your finger that you got Vicodin for. Did you need Vicodin for the laceration on your finger? You know, they tell me that the pain is 10 out of 10. So I would just look at your own practices as you delve into this issue with your children.
You would agree, doctor, you would agree. I don't think this works. You would agree, doctor, that there's absolutely no scientific evidence that opioids work.
We know that the opioids work on the brain and they make you more relaxed. We know that they do work on the pain pathways, but do we need them for everything that we do? No.
But you would agree, I mean, it's more of a masking effect when you talk about those pain pathways, fair?
It is a masking effect.
Can we send a microphone? Can we get the green microphone working, Paul?
It's on, but it's very
All right.
soft.
Let's send that one down to Mr. Edson, please.
Like that. There we go.
Can we
I feel like
send
Darth
that,
Vader.
send that green microphone to the end, please? I'm going to get a comment from Jim.
Just something I wanted to mention. I wanted to inform you of a couple things that you may think are contrary of what you would expect of us in the time of an emergency. The first of which is we're not necessarily going to administer Narcan to every opioid overdose that we encounter. That decision is driven more by their respiratory status than anything else. So our paramedics do have the discretion where they may be encountering an unresponsive or unconscious suspected opioid overdose with stable vital signs. They're breathing fine, their heart is beating fine, all their other vital signs are good. And they may choose to not give the Narcan because there are side effects that come with that administration where that individual may become nauseous to the point where they're vomiting. They may become combative. So working in concert with the emergency physicians, they say that, if you feel that the patient is stable and manageable, then, bring them into us, obviously monitor their condition, and then they can bring them around in a more controlled setting so they're not necessarily experiencing the symptoms that they would otherwise. The other thing I want to mention too is unfortunately we're seeing more and more cardiac arrests where there's no breathing and no pulse due to a heroin overdose. And I want everyone here to understand that medical science has driven us to the point where our paramedics are no longer loading that victim into the ambulance and doing what they can on the way to the hospital, including CPR and a lot of advanced techniques. What's now expected of us is to actually dig in. So we find that friend, that coworker, that loved one, wherever we may encounter them, and you're witnessing that, and you're like, they've been here for 20 minutes or 30 minutes. Why are they not going to the hospital? And that's because we're going to be able to deliver more efficient emergency medical care to that individual on the scene than we can bouncing down the road in the back of that ambulance. And that has been, proven time and time again to contribute to very good outcomes. So I just wanted to explain those two circumstances to you. So should you witness a situation like that, we want you to have a little bit of insight into some of the decision making that we make.
So Jim, while we have you down there with the microphone, we talked about Narcan quite a bit. Would you just describe for us what Narcan is and exactly what it does to the body?
Well, it's already been discussed in the presentation that preceded the panel discussion. On the panel that we have neurotransmitters within our brain stem that respond to opioids when they're administered, and resulting in all the effects, the physiological and psychological effects that were discussed. Now, those transmitters are actually more attracted in the short term to Narcan than they are the opioid that the person may have originally overdosed on. So what happens is when the Narcan is administered, it temporarily displaces the opioid from those receptor sites, resulting hopefully in a return of breathing and normalized vital signs. And that may have a lasting effect. There may be more Narcan that's needed to permanently to reverse that person's condition. On that note, one other thing I want to add too is every overdose that we encounter, even if we successfully reverse them where we find them unconscious and barely breathing, and by the time we're done with them 20 or 30 minutes later, they're walking and talking and they don't want to go to the hospital, they don't have a choice in the matter. We're taking them to the hospital every single time. And sometimes we have to look to our law enforcement partners to help us facilitate that. But there are many instances where we show up, we assess, we treat, and the determination is made that the person does not need to go to the hospital. As a matter of fact, out of those 6,000 medical emergencies that we responded to last year, approximately 1,000 of them were not taken to the hospital. But when we're talking about an overdose, every single one of them will be.
So Jim Nitel, you are one of 3 FHPD officers assigned to Sonic and DEA, correct?
Yes, sir.
So why is that important and why do we do that?
It's important because, as we learned, back in September 11th, we have to communicate with not only the state, but the local, the sheriff's departments, as well as the federal agencies. And my group, with the Drug Enforcement Administration, we are sworn in as task force officers with Drug Enforcement Administration. We're given the same arrest authorities as the DEA agents. We have the power to investigate cases anywhere in the world. We start and we focus on Oakland County and our agencies within the Sonic Group. Working with these other agencies gives us opportunity to, I spoke with an agent from the FBI earlier today about a case. We work with Homeland Security, we work with ATF, the Oakland County Narcotics Enforcement Team. We work arm in arm with all these agencies. We identify issues that are happening within our community, and we try to make determinations of how are these narcotics getting into our community, where are they coming from, and it opens the scope a little bit for us to do our best to stop the drugs from coming into the community and identify the issues that we're having here within Farmington Hills.
Okay, and let's pass that over to Jody now and talk about, Jody, you were a judge in a drug court and a sobriety court. Tell us a little bit about what those are and why they work or don't work.
It's the more umbrella term is a specialty court or a treatment court. So I had a sobriety court and a drug court, and I founded a very large veterans treatment court. As we know, our veterans, especially the ones that served in the sandbox, Iraq and Afghanistan, often suffer very significantly from addiction issues related more to musculoskeletal injuries. Anyway, if someone's arrested or they're in the court system, they have an opportunity to be referred into a treatment court. Addiction, substance use disorder, opioid use disorder is a disease. And so just as many medical professionals now are shifting gears or shifting that paradigm to treat it more like a disease like diabetes and other things like that, so is the court system. Not in every case. For example, we have 1.2 million veterans in the state of Michigan, and only about 6,000 of them have the opportunity to be in a veterans treatment court, but a very significant population have been referred into the criminal justice system. So we've got to get more judges on board. There are a lot of great judges in Oakland County, especially who run treatment courts, but it's very exhausting. It's extremely comprehensive. It's based upon a team that consists of law enforcement officers, medical professionals, treatment professionals, behavioral health, you name it, and we've got it. So we hold them accountable through probation and drug screening and things of that nature. So it's very good.
Thank you. Cheryl, tell us about how many times does a user have to use heroin to become addicted?
There isn't a specific number of times. The first time somebody uses it, they can become an addict to it. I mean, everybody's chemistry is differently, and everybody's brain chemistry is different, and one time, one rush of adrenaline going through the body, that can be enough to cause addiction.
So I know we talked about some of the signs that a child is using drugs. What's a good age to start discussing with them drug use?
We think the earlier the better. As we mentioned in the program today, you want to be your child's first educator. You don't want it to be where they show up at a birthday party and someone's passing around a balloon of nitrous telling them to take a hit off of it, or to swallow this pill, or to drink this alcohol, or to smoke this cigarette. Because when they're in that situation, they've never been confronted with it, they don't even really know what drugs are, they're going to go along with it. They're going to go into that peer pressure, and they're going to give in because they don't want to be the odd man out. So again, we really encourage that young. So late elementary school, even early elementary school, if they have questions. I started talking to my kids in kindergarten when they would see a cigarette butt on the ground, and they'd say, "What is that, Mom?" We'd have a conversation about it. I wouldn't get into a whole deal of, heroin and everything else in the world, but we talk about that. We talk about what drugs are, what they do to people, and how we stay away from those things. So the earlier the education, the better. And again, you want to be the first teacher for them.
May I just chime in on that? I did my master's in child development, so I'm not coming at this without basis, but Joe Califano wrote a really, really good book, and the National Institute of Drug Abuse actually promotes this book as well. So it's not just me, but it's How to Raise a Drug-Free Kid. And he recommends any number of different things. But one of the things that he recommends the most is how many nights you have dinner with your child. And the closer that number is to 7, where you actually just sit down with your child and open up the dialogue, just like Cheryl was saying, and I'm sorry, I can't remember your name, but how they were talking about having that conduit and that communication, taking these opportunities to discuss some things is the greatest amount of success. It doesn't matter if you're at McDonald's and just having a dialogue, or if you're at the dinner table having cooked a huge meal. It doesn't matter. It's about creating the opportunity to talk. The other thing that is showing great success around the country is a little game. And I don't want to talk politics, and I don't care how you felt about Barack Obama as president, but one of the things that not very many people can argue with is the kind of father that he was. And there was 1 hour without refute that he took out of every single day, and that was dinner with his children. And they played a game, and it was called Roses and Thorns. And this has been taken and replicated even in my own family with my kid who's back there as well. But many, many, many people have implemented this, and it works because it creates the conduit. And during that time where you're sitting down, or like we do when they crawl in bed at night, they have an opportunity to talk about the best thing in their day, the rose, and the worst thing in their day. You're creating opportunities for dialogue that are non-judgmental. You're not angry, you're not impassioned, you're calming down. So they feel comfortable opening up to you. Those are some of the most important, and I would submit to you, some of the simplest things that you can do to have a dialogue with your kids about anything. Drugs, bullying, what's on their tests tomorrow, things of that nature. So Joe Califano, How to Raise a Drug-Free Kid, have dinner with your kid, and play Roses and Thorns.
Sorry, Honor. There you go. I'd just like to add one other thing to the, when we start talking about our children, you know, the way social media is these days, the kids are learning so much from the social media that, you know, and do we want the kids to learn from social media from us? I think many times when we were growing up, our parents thought, well, if we don't talk about it, it won't come up or they won't know about it. Nowadays, with social media, they're seeing everything. I mean, we'd all be amazed at what they look at social media, and I think that's the biggest thing, why we need to start much earlier than we ever have before.
And be honest with your kids. Think about what we were told. No offense to the law enforcement officers up here, right? But even the federal government will admit that DARE failed. And why did DARE fail? Because here's what DARE said to our kids. And there's a new DARE program that's much, much better. It said, if you use drugs, drugs will kill you. That's what they said. We actually had a kid stand up to us a number of years ago. We were in Heartland, Wisconsin. And the kid said, Mom, he like turned to his parents and he said, Mom, Dad, you told me drugs would kill me if I used them. I did. They didn't. Now I'll never believe anything that you ever say to me. That's pretty profound coming from a 15-year-old. So we have to educate you all as parents. When I say we, I mean all of us up here, so that you know the good information, because the fact of the matter is your kids are going to try drugs and they're probably going to like it the first time, maybe the second time, maybe the 10th time. But it catches up to you, and that's when they're in trouble, okay? So again, the dopamine with the opioids, the prescription drugs that they're getting, that creates a euphoria. They're gonna like it until it's too late. So we have to be very honest in the message that we're having with our kids.
Thank you. We expressed that too when we did one slide real quick, and it was in your packet about communication. Know your child well so you see the red flags. And along with the thorns and roses idea, one suggestion that we've always had is anytime you teachable moments, finding them and seeking them out and using them. So if you're watching a TV show together and the kids are getting in trouble doing something, talk to your kid about it. What did you think about that? What would you have done in that situation? Give them that practice. And windshield time as your kids get older, whether in middle school and high school, they're not so much to talk to you anymore. Windshield time can be great because instead of it being face-to-face, one-on-one, they don't have to look at you. They can be looking out the window. You can ask them questions. They can answer those questions. But windshield time, where it's non-confrontational and just a casual conversation, can really help open up that communication as well. And when she talked about honesty, another thing we'd like to talk about in a much longer program is at some point your kids might ask you, well, did you ever use marijuana? well, how old were you when you started drinking? And we suggest the best thing, again, is to be honest, but don't glamorize it. You know, don't talk about, oh yeah, I used marijuana in college, man, and I partied all the time, and we had so much fun, because that's not the message we want to give our kids. You know, you could say, yeah, I tried it, I used it for this long, I realized it wasn't good for me, I got out of it, I know I'm better off without it. But not glamorizing any aspect of your history, but being honest with them, because if they find out you lied, you really lost all credibility with them.
Rich, just to add one thing. First of all, I just wanted to kind of pay tribute to a couple of our other partners out there. I mean, I was quick to credit, the emergency responders throughout the community, but we have an unbelievable relationship with Beaumont Farmington Hills, also with Henry Ford West Bloomfield. Those are the two hospitals that we transport the majority of our patients to. They both do an extraordinary job. Also, this is the Farmington Hills community. So I just want to, mention what a great job. I know we got Director Demers here that, the public safety officers in the city of Farmington do, because they're certainly dealing, with this issue as well. And they've successfully revived a number of, victims over the years. Just to the point of educating students, for those of you that aren't aware of it, East Middle School has had a program for many years now called May Day, where they take the 8th graders, and there's a number of people in this room that participate in that program year in and year out, and just come in and do presentations and have some, pretty, great conversations on tough topics with these 8th graders in preparation for high school and beyond. And the fire department, we wanted to try and carve out a niche that maybe hadn't been talked about in the past, and we do a presentation called Surviving the Party. And we lead the presentation off by saying, okay, we're going to give you the same message that every other adult in your life does regarding, not using, alcohol or drugs. But at the same time, let's say you're at a party, whether you're an 8th grader in high school, in college, or later in life, and you witness someone having a medical emergency, we want you to know what to do. We don't want you to be hesitant to call 911 because you're fearful that everyone's going to get in trouble. We don't want you to place that intoxicated individual in a bed and just feel that they're going to wake up in the morning feeling better, or throw them in the shower, or dump your child on your doorstep at midnight and then ringing the bell and running, hoping that it's going to work out. So we make them aware of the consequences, the physiological consequences of alcohol and drugs, and we try to do everything we can to empower them to make that phone call, to call 911 and get that person the medical attention that they need.
Thank you. I'm going to bring it back to this end a little bit, and I want to talk about an interesting experiment going on in Colorado, where they've legalized marijuana. And Craig, if I could start with you. Tell us what's happening in Colorado since they legalized recreational marijuana.
It's one of the things everybody has to know, and this is a way we get educated and informed, and Colorado is the perfect science experiment for all of us. They've had legalization of recreational marijuana for the last 2 years. Our state should be watching what's happening in Colorado to see what's going on. And I can tell you what's happened is that THC content is up to 32 to 34% in smoked marijuana, 80 to 90% in medibles. Traffic deaths, where it was drugged driving, not alcohol, but marijuana, up substantially in Colorado. Past marijuana use for 12 to 17-year-olds, the national average is 7.2%. In Colorado, it's 11.13%. Number one in the nation for 12 to 17-year-olds using marijuana in the past month. 18 to 25-year-olds in marijuana. The national average is 19.7, 31.75% of the 18 to 25-year-olds in Colorado have used marijuana at least once in the last month. So hospitalization rates due to marijuana exposure in Colorado up significantly. Drug treatment admissions up significantly. The pro-marijuana people will tell you that marijuana is not addictive. That's wrong. You have to go to the science and find out. In the state of Michigan alone, in 2016, We had 7,253 publicly funded treatment admissions for marijuana abuse. Those are just publicly funded. Those aren't people with private insurance. That doesn't even recognize the people that don't realize or won't admit that they have a substance use problem. Poison control, kids getting poisoned. In Colorado, there are more medical marijuana stores and recreational marijuana stores than there are McDonald's and Starbucks. There's 500 combined in the city of Denver alone. They sell marijuana looking like gummy bears, like Snickers bars, like Fruit Loops, like drops, like anything that you could think of, brownies, cakes, cookies. And the THC content in those things is so high that kids are getting poisoned, and they're calling the Poison Control Center. 18,000 people in 2015 went to an emergency room in Colorado because of their reaction to the marijuana that they used, some type of psychotic behavior. So that's what's happening in the state alone, and there's more than that. And what I would strongly urge you to do is get educated. Go to the sites like the National Institute of Health, the National Institute on Drug Abuse, the Center for Disease Control. In regards to marijuana legalization in Colorado, go to the Rocky Mountain HIDA site at rmhida.org, and they will give you the real statistics of what's happening, not the stuff that you're hearing anecdotally or people are just putting across on the television.
Craig is absolutely right. Rates of drug driving nationally in this country have exceeded rates of drunk driving. So no longer do we just have to tell our kids don't drink and drive. We have to tell our kids don't use drugs and drive. And because it's a very real dynamic in that regard. The Journal of Neuroscience actually released a study about a year ago that talked about young adults up through the age of 25 that even occasionally smoke marijuana, and they recorded an 8 to 12 decrease in IQ. So I always tell kids when I talk to them, if you want to get stupid, smoke some pot, right? Not only that, because of the increasing potency rates of marijuana, we are seeing schizophrenia and all of these psychotic episodes, and another thing called amotivational syndrome as well. When we kind of laugh when we think about the pothead, how they're just sitting at home smoking pot, playing video games, and maybe eating a bowl of spaghetti, right? But it affects your frontal lobe, so that's your area where you form judgment and motivation. So they become very, very lethargic, and we're not seeing an unringing of that bell. Of course, there's not enough significant longitudinal studies on the effects of marijuana, especially at these potency rates, because the Drug Enforcement Agency just simply, they control all of that and who's gonna volunteer for that type of report. So our kids need to understand that there's very significant consequences to their IQ, their driving record, their ability to get federal student loans. If they have a conviction for marijuana, they won't qualify for their FAFSA. And yeah.
Most of the longitudinal studies on marijuana were done on marijuana with the THC content of 12% or less. Now, I'm not a scientist, nor am I a PhD, but if at 12% you're having negative effects to the brain, I have to believe at 36 to 80% it's worse. And one thing I wanted to mention about what's going on in this state, 218,000 medical marijuana card holders in the state of Michigan right now, 38,000 caregivers. A medical marijuana card holder basically needs a letter from the doctor and an exam saying that medical marijuana, they believe in their opinion, will help cure one of their problems. They can possess 2.5 ounces of marijuana and grow 12 plants at any given time. Have that. If you're a caregiver, you can have 5 patients. So you can have 2.5 ounces of marijuana for yourself and your 5 patients and grow 12 plants for each of you, which is what, 60 plants, 72 plants. A plant produces about, on the average, small plants now, 2 pounds of marijuana. So that's where we're at right now. 79% of the people that have a medical marijuana card in Michigan, their diagnosis or their problem was severe and chronic pain. The other 18% was for severe and persistent muscle spasms.
The only thing I'd like to add is interviewing hundreds of heroin addicts. Marijuana you'll hear is referred as a gateway drug. I can tell you that almost every single time that I interviewed one, they started with marijuana. It started with marijuana and escalated to a more potent drug like heroin. So it's definitely marijuana is a gateway drug, and it's something that we have to strongly consider.
To date, and being current on some of this marijuana data, nobody's ever died from using marijuana, okay, per se. However, the edibles are where we really have to watch our kids. Those inhalants that you heard Cheryl, and I'm so sorry, what is her name? Gretchen, thank you, talk about earlier, are where we have to be very careful. I talk to all of these kids, and they say, no, I have a really good drug dealer. A really good drug dealer. They're really awesome. Like, I get a flat tire, they come out, they change my tire, they deliver my drugs. I'm like, you're right, that's a great drug dealer. Okay? And of course they want to give you good service, and we want to educate our kids on why they're a really good drug dealer. Well, the other thing that they're doing, especially when it comes to marijuana, is they're competing, because marijuana is a business, and our kids don't understand that it's a business. And so if we're both selling pot, which he really is, just kidding. No, but if we're both drug dealers, he wants his pot to be better than my pot, or his edibles to be better than my edibles. So they lace it. And they lace it with things like synthetic drugs that we thought were gone are now, the same levels of potency as some of the marijuana. So they get some of the psychoses the same as the marijuana. But with the edibles, the potency rates are even higher. Psychosis is extreme. There was a kid in Colorado in the last year that jumped off of a building and died. The cookies, the brownies, things of that nature, they come with very specific instructions. Your kids can order them over the internet and have them delivered to the house. So think about your 16, 17, 18-year-old kid. If he gets a marijuana cookie and it says eat 1 bite every single hour, or not more than 1 bite in an hour, it's a cookie. 1, he's hungry. 2, it's 1 bite, and they're not going to feel it right away, so it's going to take some time. So what do you know the kid is going to do? They're going to eat it all. They're going to have psychoses. They're going to be in trouble. So we've really got to educate them about what it is. The vaping pens, those really good drug dealers take syringes now and syringe it right into the little vaping pen capsules. So all of those other substances, the Drug Enforcement Agency has the best toxicology lab in the entire country. Right? They've taken thousands of these capsules, these vaping capsules, and they've tested it. And all of those substances, like Cheryl told us about, are in there. But oftentimes they're finding unspecified chemicals or unknown chemical compound combinations. Same thing in the marijuana. They just don't know what they're getting.
The other thing with medical marijuana in the state, everybody knows what it's like to get a prescription or even to take a Tylenol. It says on the bottle, take 250 milligram Tylenols every 4 to 6 hours for pain. Don't take more than 12 in a day because it could cause liver damage, and on and on and on. When you get your medical marijuana card, there is nothing like that. There's no dosage, there's no THC content, there's nothing like smoke 3 fatties every 4 hours a day or anything like that. You can smoke as much as you want. You don't know what the THC content it is. You don't have any, there is no qualifications at all. It's once you get the card, you basically can smoke a joint every half hour if you wanted to. As long as you didn't exceed your 2.5 ounces, which is, 2 ounces is 56 grams, so that's 28 2-gram marijuana cigarettes, and you can have that every day if you wanted to.
One last thing I was going to mention, and during the previous presentation they mentioned about the marijuana wax extracted using butane. And one of the things in my groups, we have two cases going on right now. One of them is in one of our neighboring communities, one of the Sonic communities, where we had butane ovens that were used. And the federal prosecutors have taken a very strong stance in this because we've had residents and businesses blow up because of the improper use of this butane. And not only the house that they were cooking and pulling it from, but the neighbors' houses as well. So it's very hazardous to cook. It's, again, as Craig mentioned earlier, these are not scientists that are constructing these butane ovens. And when they put them together, and unfortunately, if they do it the wrong way, it can be hazardous and it can cause death. So the federal prosecutor's office will take those cases, and we do prosecute those cases.
Can we pass that down to Jim?
Yeah, I just wanted to, just on behalf of our paramedics, I wanted to give you, our insight from the tip of the spear per se, and that is that this is a public health crisis. Not only in its direct impact on those individuals involved, but on the entire system. Now, I want to put that in the right context by saying that whether you're calling the fire department or the police department or going to the hospital, we're there for you every single time. We're non-discriminatory, we're non-judgmental, we're compassionate. We will do whatever we can do to help you when you're having a problem. But with that being said, ambulances are a precious commodity. And I'll defer to Dr. McParland on this. Hospital beds, particularly emergency department beds, are a precious commodity. And at any given time in the year, we have multiple individuals that are calling us. Let's just say one individual is calling us every day, resulting in a transport to the hospital for alcoholism or some other form of substance abuse. We're there for that individual. We're trying to do whatever we can as a system to work with the hospital and get them the help that they need, but our hands are tied in a lot of ways. And that's taking the ambulance away from you or your family member or your neighbor who may be experiencing some other type of medical emergency at the time. So this is a great forum in the sense that we're hopeful that the information that we can share with you is beneficial, but it takes a village. Like Richard mentioned, we've got over 80,000 members of this community, and speaking on behalf of your fire department, we need your help. We need all hands on deck to try and address some of these issues to continue to make this the great community that it is.
Jim, we had a question from the audience while you have the microphone there. It said, do you find that you have repeaters for emergency calls for overdoses?
We absolutely do. So and we've had individuals over the years that we have just to give you a few anecdotal examples. We've had individuals where we found them overdosed, resuscitated them, took them to the hospital. The hospital is able to hold on to them for a certain period of time before they can leave, maybe against medical advice, and then they go back to wherever we found them, and what do? They overdose again. And we've had instances where we resuscitated them the first time, and then literally hours later they overdose again, and we're unsuccessful in resuscitating them. We've had, again, we're not immune from the challenges that all other communities face. We had a situation where a mother and son, who we've encountered on numerous occasions in the past, whether it be overdosing together or separately. We had an instance where mother and son overdosed together on heroin in the restroom of a store within our community. And we have so many repeat patients that one of the things that I do is I do quality assurance. I look at the job our paramedics do and see what adjustments we can make, to make our system better. And it's not unusual for me to have a name come across my computer screen, and I'll say, okay, we went there for an overdose, and I'm pretty sure we went there not that long ago, for similar circumstances. And then you do a little bit of research, and you find that that's the case. So I wish I had the specific data for you, but I will tell you, out of the overdoses that we encounter, we do have quite a few repeat patients. And maybe contrary to the national or regional data, I would say that of those 60-odd patients that we, opioid overdoses where we administered naloxone or Narcan in 2016, I would say that well over 80%, maybe as much as 90%, was heroin and not a prescription medication. Now, again, that may not be the norm compared with other communities, but almost all of those overdoses that we're reversing with Narcan involved heroin or something similar to heroin, like like fentanyl, or we did have one carfentanil case in 2016 where that individual did survive, but we haven't encountered the problem with the prescription, or at least we haven't detected it maybe as much as other communities have.
Let me do one more audience question if I can. And this, I think, could go to any one of you. Whoever has a good answer, please pipe in. My child has been involved in drugs and alcohol. I feel I have little control. I can't monitor her 24/7. They go to school where there is ample supply. I feel helpless. Anybody want to take this one? We'll start with Cheryl.
I'll start, and then anyone else can chime in. There's always hope. Let's never give up on hope. And our suggestion is calling counselor and getting them assessed and getting them into treatment. And I know laws keep changing on this, but you as a parent, can force your child into treatment up to a certain age. And then there's even a law now that even above age 18, that you can force a family member into treatment. You'd have to pay for it out of pocket, but you can force, go to the courts, right? Go to the courts and ask to have somebody admitted for treatment. Treatment does work. It takes a village, and it's a lot of hard work, and heroin addicts relapse over and over again, as many types of addicts do, but there is hope. So my suggestion is seeking out a treatment center, calling them, taking your child in there for an evaluation, and starting from there.
Absolutely. Reach out to someone. Law enforcement is a great place to start. Don't be afraid of that, okay? Recovery, remember, this is a disease. And by the time your kid is using heroin, if your kid or your young adult starts using heroin, recovery rates are like 2.5% to 5%. We very seldom can get them out of that cycle. That doesn't mean they're going to die of a drug overdose. Their longevity is going to be shortened, but they will probably live the majority of their life as an addict in some phase of that addiction state, because the power of the addiction by that point is so strong. That's why it's so important that we catch it early and that there's early intervention. In Oakland County, we are very, very blessed by services, by funding. There's a lot of barriers that are broken down in Oakland County and made available to people who do reach out for services. You can call Common Ground right away, and they'll find a placement for you very, very quickly. You can reach out to the court system, to the law enforcement system. I think it sounds like Farmington Hills is sort of a mecca as well with regard to their non-judgmental attitude. But you'd be very surprised about how good the judicial system is about engaging in treatment and supporting the system, and not just a punitive fashion as well. If they're minors, the juvenile justice system can also help with referrals and getting them in. There's a number of tremendous facilities in this area. Milford Counseling has an 85% success rate for opioid addiction, which is unheard of. I vetted it and used it, not for myself, but for the people that were on probation with me. Very excellent, very, very excellent. It's phasing. See, understand the difference with opioid addiction, whether it's pills or heroin, is that not only is there the physical component, which is strong. That's why when Jim goes and he saves someone, they turn right around and go use again, because they're going to be sick. They're going to be really sick. They're going to be so sick, some people kill themselves because they don't want to be sick. And there's one way, and one way only, to keep from being sick. And that's you use again. And you have to chase that high. You keep going, and you have to use more and more and more, or you're going to get sick. So it's very, very tough. It is a disease. We have to treat the physical part of the disease, but then we have to treat the behavior as well. So it's very, very significant. There's often mental health and trauma and other issues that are all wrapped up into this. And we're lucky in Oakland County. Reach out to someone. You will get help. You're not on an island.
So thank you. Jim, did you want to get a word in?
Yeah, this is a parental forum, so I, like probably many of you, wear a lot of different hats. The most important hat that I wear is I'm the proud father of a couple of Sparties. Go Green. And so I've got a couple of kids who came through Farmington Public Schools and are now up in Michigan, State, and knock on wood, are doing well. I think I would anticipate a lot of police officers and firefighters in the room to probably nod their heads when I say this. We see a lot of unpleasant things over the course of our career. And when we go home, sometimes it's difficult to share what we see with our family members. And we want to try and protect the innocence of our children. But at some point, we come to this realization that we need to have some tough conversations with our kids because they're going to be faced with some tough situations out there. So maybe at some point, we take a little bit of that innocence away from them when we share those stories. Now my kids are in college, and now they're educating me. They're telling me what's going on. My daughter is the president of the Women's Council at MSU. And both my kids they're doing very well, but they got their eyes and ears open, and they know what's going on around them. And when the farm parties were mentioned earlier, I turned to Jim, and what my kids had shared with me is, they know of those farm parties where there are individuals, whether they are actual licensed healthcare professionals or just supposed experts, that are actually doing testing. They're doing some sort of field testing at these parties and then telling kids which drugs are safe to take and which drugs are unsafe to take. So, those are just, when we feel like we're getting a handle on something, then all of a sudden something else, pops up. So the last thing I would say on this is trust your parental instincts. If you think something's wrong, if your spidey sense is going off, then there's probably something wrong. And I would say don't delay, don't procrastinate, because God forbid you put it off a day and that next day something tragic happens. So, seek out that help that everyone's talking about as soon as possible. Don't look for excuses to not call for help.
Jackie, did you want to say something in closing?
Yeah, I have one. This is in response to the question or the statement about a child who has an addiction problem. I lost my brother and my father to alcohol. There is not a day that doesn't go by that I ask, was there one more thing that I could do? Form a tribe of people in your family, of their friends, to help be the support person for that individual. Get them into long-term treatment, because a short-term program is not going to help. You need a long-term treatment program. And then you're going to need ongoing treatment. And right now we have some medications that will help have an effect if it's alcohol and abuse is a drug that they take every day, and if they drink, they are deathly ill. So it helps prevent them from drinking once they were physically recovered from that drug. So do not give up. There is help. There are supports. Get yourself to AA or Al-Anon. And like I say, get family to help you, because when that person dies, you're just going to be left with regrets about what else you could have done.
So we're going to wrap up. I know you guys have been in your seats for a couple of hours now. I just want to leave a few thoughts here. First of all, Commander King is here somewhere. He's in the back. He will be outside at the police desk, and he's got a Narcan kit with him. For those of you who would like to see what's involved in that, he will walk you through it. I want to thank Commander Demers from Farmington and Chief Nebus from Farmington Hills, Mitch Seeley from Call to Action Coalition, who also runs a teen Al-Anon group. If you want to talk with him, he's the teen and substance abuse and alcohol abuse guy. I want to thank our panel for being with us tonight. Can we give them a hand? I'm a parent too. I've got a Sparty and one student at school here, and I'll tell you what we do. We have what we call the Spaghetti-togethers, and we make sure our house is a place where kids like to hang out. And when the kids come over, we give them a big hug when they come in, and they think, oh, your parents are the best. They always give me a big hug, but we're smelling them. We're checking out who's been smoking, who's been drinking, and we know. And we have these spaghetti-togethers Friday night, Saturday night, whatever. We tell the kids, have your friends all come over. We put a few pounds of spaghetti into the pot, and they sit around there and they eat. We know where they are. Our basement's the greatest place in the world to hang out. It's got all the games and toys they like to play with, and we feel good about where they are. It's an alcohol-free environment. We know what's coming into the house most of the time. We keep an eye on them. and that's how we stay comfortable. So my tip is to get together. I thank you all for coming out tonight and caring about your kids and doing this. We did record this on TV 10, so we're going to get a chance to broadcast it because we'd like to get the word out to more people. Thank you again to Cheryl and Gretchen for coming out and doing the Drugs 101 program. And we also have Farmington Safe outside. You don't have to be suicidal. They are people who know how to find help. They're here because there is such a correlation between drug use and attempted suicides, particularly teen attempted suicides. So they like to say, no one ever says you've got cancer, get over it, but tell them you're depressed. So if you feel you or your child needs some help, they're a good group to talk to. And the panel will be around here if you'd like to ask them any questions afterwards or stop out at the tables outside. So thank you for coming out tonight.